Prior to the procedure, it is important to ensure the donor has not had anything in their mouth for at least 10 minutes prior to the oral fluid collection. This includes food, drinks, gum, and tobacco products. Request the donor to begin pooling saliva in their mouth to aid in collecting enough oral fluid. This is a key step to speed up the collection process. The OralTox procedure allows the donor, in this case Sarah, to conduct the test themselves while observed by the test administrator. Carefully inspect the OralTox pouch to ensure there are no tears, cuts, or damage to the packaging. Check the lot number and expiration date. Open the foil pouch, have the donor open the package and place the device on a flat surface in front of them. Instruct the donor to introduce the collection swab into their mouth, rotating it, and sweeping the sides of their cheek, gums, and tongue to initiate salivation. The donor must not chew, bite, or suck on the sponge. When there is enough oral fluid for testing, the indicator strip will start to turn red. Continue collecting until the red color is very pronounced. Otherwise, there may not be enough saliva to run the test. Next, insert the collection swab sponge first into the device, pushing and turning until the threaded handle locks into place. Observe that there is sufficient oral fluid coming in contact with each strip. The OralTox device should remain on a flat surface at all times. Make sure that the top control line is visible for all test strips. Otherwise, the test is invalid and the results must not be used. For manual interpretation, it is common for line intensity to vary. If there is a line, despite how faint, this is considered a line and thus a negative result. The OT-Scan app can be run once the control and test lines appear for each test strip. Wait 10 minutes before running the app if no apparent color appears in a test region. Once the test has been completed, the test administrator, in this case Jim, initiates the OT-Scan app to scan and interpret the results. To initiate the OT-Scan application, tap the icon from the device home screen. Sign in using your assigned username and password. Read the license agreement and tap Accept to proceed. The agreement will only appear once per user login. Select Manual Order from the order selection screen. Enter the donor's information including name, date of birth, ID number, and gender. The final two fields, CM Customer Name and CM Consumer ID, are optional fields allowing additional information to be captured. These fields are optional or can be utilized based on your organization's decided workflow. Once the donor information has been entered, request the donor to tap the slide toggle icon, sign using their finger in the allotted space. Tap through the tutorial screens to learn more about the collection procedure or skip this step of the process by tapping the skip button. Tap the Scan QR code button to initiate scanning. Align the window with the QR code, located on the top right corner of the OralTox device. The collector will select the reason for testing and sign using their finger in the designated signature area. Once complete, tap Done. When initiating the scan, hold your phone approximately 2 inches away from the device, aligning the app indicator lines to the device label. Slowly pan the phone outwards, away from the device, tilting and aligning until the guided red indicator changes from red to yellow and finally green. While the guided indicator is green, hold the phone steady to allow the app to begin capturing the result. A blue progress bar may appear showing their progress. However, in most cases, the app will present the results almost immediately once aligned properly. Alternatively, both hands can be used to assist with alignment. In the case of event there is a glare or strong backlighting from another light source, the app may take longer to capture the results. Try moving to an area where there are adequate but consistent lighting, while limiting the possibility of stronger direct light and glare if this occurs. Once the scan completes, the results overview screen will appear as the data is being sent to Premier Biotech's data portal. If an integration has been established, the results will be communicated to an assigned solution. For security purposes, information is not stored on the mobile device. To see the result details, you can tap the details icon at the bottom right of the screen. Bluetooth printer options are also available within the app. Tap the print button to pull up the printer options screen. From here, choose the printer and select a number of copies. Confirmation testing can now be ordered directly from the OT-Scan app. This removes the need to manually complete chain of custody forms, resulting in huge time savings. If the results are negative, the test is complete, and the candidate is eligible for immediate hire. Following an inconclusive result, tap the Done button to begin the confirmation ordering procedure. Select the oral fluid device used for confirmation. OralTox allows for confirmation testing with the same original sample. Tap Continue. Scan the barcode located on the security seal provided by Premier Biotech. Have the donor write the date and initial in the designated space on the security seal. Remove the security seal and place it over the top of the OralTox device cap and down both sides. Be sure not to cover the device QR code. Enter the donor's phone number including the area code. The confirmation test has now been ordered. Place the OralTox device into the specimen bag and seal it prior to placing the sample in the shipping pack. Adhere the shipping label to the shipping pack. Seal it, and sample is ready to be shipped to the lab.